group of people with type 2, unfortunately, it is when they have complication that it is diagnosed. I've seen people with foot ulcers because I've actually studied foot ulcers a lot. And 25% of the people I studied, that's 25 in 100%, 25 in 100 people will come with foot ulcers. And when they tell you this wound is not healing, doctor, the wound is not healing, I say, let me check their blood glucose. It is high.
Sometimes it's from the eye clinic. Before the foot ulcers,
yes,
when they come with symptoms of extreme thirst and blurred vision and all that stuff, are those early or late symptoms?
Well, it's difficult to say they are early because we've seen that by the time people present, it must have been ongoing for some time. So sometimes we say 3 months, if that is all they are presenting, because there's a process. You have normal blood glucose level. There's an in-between stage between normal and diabetes where you have the glucose levels are higher than normal, but not high enough to be in the diabetic range. We call those group of people that they have pre-diabetes. So these people in pre-diabetes, it's not a simple innocuous state. We tend to be very aggressive with pre-diabetic state.
So it's
for
treated.
2 reasons, yes. For 2 reasons. This group of people, some of them could develop diabetes ultimately. So we go beyond exercise. If you're big and you have a family history, we start treating you with drugs, mild drugs anyway. Then stand alone, just having that pre-diabetes state puts the person at risk for having any of these complications like stroke, heart attack, anything that will affect the vessels. It puts the person at risk, even if he or she ultimately does not develop diabetes.
Okay, so let's go on to the foot ulcers. People have wounds because of diabetes?
Yes.
Why?
I will tell you why. The reasons are many. If somebody has diabetes, first of all, I want to make it clear to the public that if somebody has diabetes and the blood glucose levels are well controlled, the person will live his or her whole life without complication. But if the glucose is not well controlled, then we start having complications, of which nerve damage is foremost. And when we talk about nerve damage, remember the nerves run from up here down to the toes. Yes, but the commonest one will be the ones that affect the feet. So that's the nerve damage. And there are 2 types. The person can tell you, I don't feel anything. I've seen a patient walk out of my consulting room without her slippers. And I called her back. Your slippers is not on your feet. She said, doctor, it is on my feet. When we looked at her feet, the slippers was not there because she didn't feel. Yes, so
she couldn't feel anymore.
So you can imagine such a person walking a long distance like that and having injuries without even knowing there's an injury. So that is one way nerve damage could present. Another way it could present would be with pain. This group of people, they will have severe pain, which is worse at night. I think they call it in the local parlance, paja. It is really terrible. Sometimes it's bad enough for us to admit these patients.
Is the pain because of the nerve damage or because of muscle damage?
No, the pain is because of nerve damage, and there are different kinds of nerves. So depending on the particular nerve affected, the person could have the painful neuropathy. Depending on the particular nerve, the person could also have that type which is numb. But if you ask me, to have none of them is good, but it's better to have the painful one, like the number one.
You can detect it in time.
Thank you. So what we do is, okay, so that's one of the complications. You want me to talk about other complications?
Yes, please, go ahead.
Okay, so other complications. So that complication of nerve damage can actually lead to foot ulcer. Now there's another complication which is kind of shrouded in mystery, I will say so, because like 10 years back, there was this notion that black people, you don't see them having much of damage to their blood vessels. The vessels that supply the limbs, you don't have them. Just because
one wonders why that myth was around.
Yes, because we didn't have the equipment to detect, but now we have the equipment. And presently, I'm even donating to 20 hospitals, my NGO. So what we do is we screen these patients, we check their feet. Because when the person has a damage to the blood vessel, there may be no symptom. Then the person may also have symptoms. Like the person is walking, he will tell you, when I walk for a short distance, doctor, I feel pain in my calf muscle.